Good evening, sir. So I know that you don't require you don't require an introduction because you're someone whom we all look up to, like a pioneer in interventional radiology in India, and I'm really glad that you're a part of Elitemed. So let's start about how we came to building something like how Elitemed happened. I think we can talk about that.
Yeah.
Right, sir?
Yeah, thank you, Prabhala. I think, it's actually, first of all, thank you this has happened. It's a lovely situation to be in because Elite Med has happened probably because we both connected. And I think for me, the important thing is that we were truly honest to each other as to what our personal passions are.
Yes, sir.
And I think that the common thread is probably a strong desire, inherent desire that we both have, that we want to be part of interventional radiology, probably in a much bigger way than what it is.
Yes, sir.
So for me, Elitemed has given me a chance to really bring out some of it was hidden passion, to bring it out to the public, in a larger way. So I'm really looking forward to seeing how Elitemed will help us take interventional radiology to a greater height,
Yes, sir.
and that will involve many aspects. And I'm sure we both will have to do more than what we have done so far for bringing interventional radiology to the forefront. Just briefly, I wanted to say that interventional radiology has come a long way. If you look at the father of interventional radiology is somebody called Charles Dotter, and maybe early 60s. And in 2023, already it's made a big mark. But we've always felt all the interventional radiologists who have been part of this, greater pioneers, than me, who have been part of this journey, have done a lot for interventional radiology. But I feel that we owe it to their dreams and the future dreams of the, budding interventional radiologists. So there are a lot of unmet needs. Whenever we create something, we are always looking for unmet needs. So I feel Elite Med will give interventional radiology its due credit, which is long owed, in kind of being in the forefront of, like education, research, the larger good of patients, which is where really we all are, focusing on. So yeah, I think truly extremely, in a way, I'm very grateful that Elitemed has happened for me, and I'm actually, very excited what all might come up. And I can tell you for surely that I'm sure I fully believe in what you're going to contribute, and I believe in myself that I would want to do more than 100% to fulfill, if we say, our mission or vision or goals for Elite Med. So I think Elite Med is, I just have to repeat myself here. I think it was long due for interventional radiology for it to happen. Yeah.
So right after our previous workshop, I've been getting calls from my colleagues, my peer group. They've been telling me like, see, we all were confused about what is interventional radiology, how to look up to interventional radiology, and how to even reach there, how to even know anything about interventional radiology. I think Elite Med is kind of breaking that barrier between
Correct.
medical students for them to upskill their skills
Correct.
to get into interventional radiology, right?
True. Yeah. I think our first workshop was the true testimony to that, right?
Yes.
And even though by the end of the workshop we were actually pretty tired, but actually we could see the enthusiasm in the young doctors with whom we interacted over the 4 hours, on a Saturday. But it was reassuring to see that there is such a hunger, true hunger for people to learn new skills. And I think Elite Med will, without any doubt, I'm like super confident that Elite Med will fulfill that gap, which is right there. From a medical student's point of view, I think Elite Med's initiative in opening, it's like opening the floodgates, right, for upskilling their, So a lot of the, when we all have been medical students during our time, and nothing more exciting than when you learn a new skill and then we see it apply on whatever needy patients who come our way, and then we make a big difference for them. So I think interventional radiology skills, when Elitemed takes it to medical students, I think it will be very well received, and I think we've seen that happen, and I'm sure there is more to be done in trying to reach every medical student. Like we both discussed it many times. We want every medical student to be empowered with interventional radiology skills. Even whatever little skill that they learn, that will go a long way in their future. And I think, again, it comes to home the point that everything that we do as doctors has to be patient-centric.
Yes.
We're always taught that. But I think many times with all the pressures of our work and learning our own skill and, many other pressures that we all have in life, maybe sometimes the focus is lost. So I think Elitemed could also, probably help us to refocus that, we want to do something which is patient-centric, patient-friendly. And interventional radiology, Elitemed, I think can make that happen.
Yes.
Even if there are little gaps, I think we can fill those gaps. Yeah, that's what I believe.
And also training medical students, it's like training them as soft skill, as something like a shedding a technique.
Yeah.
Only that, if they are getting trained during their internship period, we know that how much outcome that can have, that can bring into patients' life.
Correct.
When they go out there and then do even a GP job or a casualty medical officer, for them to get the confidence to, I still remember my first IV line that I was taking, and central catheter, how I was doing it. So if they are getting confident enough before getting out to the real patient, it's going to be a life-changing day for them, right?
Correct. Yes. Yeah. I think we owe it to Dr. Seldinger. It's one of those basic skills that we as doctors need to have. But when we are able to teach that skill in an ecosystem which is very protective, but with a sure shot outcome of success, then clearly that is many times it is life changing. You and me know, and getting an intravenous access in a needy patient is life saving. So, and selling a technique will not only refine that skill, but I think it will reassure that individual doctor to believe in themselves that in times of need they will be able to use that skill. It's a
confident.
Yes, 100% confident.
They don't have to wait for the senior to come and then
True.
They can actually save the patient's life right away.
Yeah, and one of the technique, even though it can be done blind, but we are now focusing on using image guidance, right? Yeah. In the workshop we did that, ultrasound guidance, sending a technique, and that skill is very empowering in terms of. And then that basic skill then opens up the whole remit of, like we have a potpourri of interventional radiology procedures that.
I know. For us, it's like when we go to the radiology department, it's somewhere like, we don't get much of an access, or we don't have much of an interest there because we are not exposed to it.
Yeah. I think the workshop clearly proved that that's achievable, and. We've just got to do a lot more of it, so that everybody can, get the true benefit of these workshops. Yeah, and I think the goal of, every medical student achieving that skill is, I think, very doable. And once we are able to reach out to them, then they will find a way to, learn those skills and then use it in their daily practice. Yeah. True.
And we were discussing, me and my friends, we were discussing like interventional radiology is something like a hidden gem in medicine. We all know something about it, but we don't know actually what it is. And what about the patients, like the way it can impact the patient's life?
Yeah.
It's really wonderful.
True. Yeah. I think, hidden gem is definitely true. And I think many times we say this interventional radiology as a subspecialty since been, the last 5 to 6 decades that it has come a long way. I mean, in a simple way, I've used this analogy in my initial talks when I was keen to contribute in awareness and motivating the next generation of budding interventional radiologists. So I've used this analogy, which I've heard before, about how would you decorate a room, right? So, for example, let's say you have a room and you have to decorate the interiors. You have to beautifully paint this room. So if you asked, let's say, a surgeon to do it, then he will have to open the door, get inside the room, and then paint it. Then the next came, keyhole surgeons. So if you tell them that, okay, you can't open the door, it's locked, but you have to still paint this room, then he'll go through the window, find a way to go through the window like keyhole surgery. And then what is so special about interventional radiologists? You'll say, okay, the interventional radiologist is given a more challenging situation, and you say you have to decorate the room, but you can't. The door is locked, the window is locked, you can't do. So he said, so he will find the keyhole in the door. He's able to put special devices, catheters, and wires, like we do in interventional radiology, but he's able to still go and beautifully decorate the room. So the outcome is a well-decorated room, but you can see from opening the door to paint it, to the window, and to the keyhole. So terminology for interventional radiology has developed from keyhole to pinhole. So essentially it is, other terminology we use is minimally invasive surgery. So using that principle, interventional radiology, like you said, it's made a huge impact in helping patients, not only in what we call as elective cases, which are planned cases, or even in an emergency situation. So the range is very wide. And another beautiful thing about interventional radiology is that they will always, as a specialist, always find a solution to help a patient.
Yes.
I think that's the beauty. There was a time when we were, we first become a radiologist and then become interventional radiologist. We used to say that for any hospital, radiology is the backbone. Today, I think, we can confidently say that radiology and interventional radiology is the backbone. And I think without an interventional radiologist, actually, I think today, hand on heart, I can say that you can't really run an acute care setup in any part of the world. So I think the spectrum is huge, the impact is huge, and like I said, many times it is life-saving. And so that's extremely rewarding. I take a lot of pride in being an interventional radiologist myself. But I think Elitemed will, I'm sure, will fulfill the goals of, one is awareness. I think, there's a huge need to build awareness. Then there is a need to collaborate and motivate the next generation.
So can you share any personal anecdote or an interesting case that you've had, a life-changing case in the patient's life by interventional radiology?
Right. Yeah, it's, this is a very common thing that we get asked, but at the same time we experience it also. Just to share just something which happened a few days back in in a Manipal hospital itself. And so this was a story of a 36-year-old lady who basically has had 3 successful pregnancies, 3 cesarean sections, and she comes from a family of doctors. They have their own hospital about 2 hours from here. And her brother is a cardiologist who actually works in our hospital. So she had an unplanned pregnancy, and then she went for an ultrasound scan, and the ultrasound scan said that you have a intrauterine gestation, and it was about 8 weeks live pregnancy. And then she spoke to the family, because they're all family of doctors, and then they said that go for a medical termination because it's an unplanned pregnancy. And that was she's undergone received the injections, and unfortunately for her, it was actually just close to midnight of that night. She had a massive bleeding per vagina. So she had a massive bleeding to the extent that she actually went into a shock. situation, and then she had to be put on inotropes, which is, medication that was required to keep her heart going. And then she was, blue lighted. The ambulance brought her to the hospital, and then the gynecologist on duty attended to her. They did the right thing. Very important, they reached out to us, and I think that is the message here, that interventional radiologists have to be involved very early in a situation like this. So somebody who's had a pregnancy, who's undergoing an abortion, can have a massive bleeding. But here the ultrasound which was done after they came to the hospital showed that the pregnancy was slightly lower part of the uterus. So that raised the suspicion that maybe that previous cesarean section caused the what is called as a scar pregnancy. And that because of the raw area where the implantation has happened, patient had a massive bleeding. And she was admitted, she had to be intubated, put in the ICU, and then we were called in and we did a CT scan to confirm where the abnormal bleeding is happening. And after the CT scan, literally in the next 10 minutes after that, we, the patient underwent the procedure. So the procedure we did was uterine artery embolization. So the idea of doing that embolization was, one is to stop that acute bleeding, and then also to help the surgeon to then go into the surgery after that. And the glad thing was the procedure went on well. So we were able to do what is, a pinhole technique with putting a small tube, getting into the artery, where we could see in the angiogram where the bleeding was. And all of this actually took just 20 minutes to do, for us. And the bleeding was stopped, and then the patient went ahead for surgery. And the feedback we got from the gynecologist the same morning, excuse me, was that it was a bloodless field, so they could, remove that, the pregnancy which is not required without losing any further blood at all. So patient had a very, safe surgery and made a very good recovery. So it's extremely satisfying because not only it was life-saving, but actually uterus-saving. And that's one thing interventional radiologists are very passionate about. We've run a lot of campaigns to preserve the uterus. So we have something called the Save the Uterus program for a lot of young women who have, fibroid-related symptoms, for example, and they're having a lot of symptoms from that. So that's similar situations we see in many other scenarios as well, where life-saving procedures are done by interventional radiologists, and extremely rewarding. And I think we could easily motivate any medical student that this is something you could do, and that can be life-changing for them and for their patients. So it's a pleasure to be part of this journey, actually. Yeah.
And when you were saying the story, all that is going on in my mind is about what if the same similar situation is going to a small hospital or in a remote setup? Will they be getting the same treatment? No, right?
No.
Because they don't know about interventional radiology.
Correct. Yeah.
Or,
So I think I think that's the need of the hour now. I think we have the skill sets we have. We have to obviously train more people. And then make these procedures available in every hospital wherever there is going to be a delivery happening.
Yes.
So we know deliveries happen in a small district hospital, but interventional radiologists are not there. So I think raising the awareness, creating a larger pool of interventional radiologists should be our goal. And I think Elitemed can, once again make that happen. Create a community of like-minded doctors, interventional radiologists to collaborate and to some extent help each other. And then we can take the skill set to pretty much, I actually believe that every district hospital we can have, easily doable.
Yes.
Because the infrastructure is already there. We just have to link the need with the providers. And I think Elitemed can make that happen. And that's the journey we have taken this step, and I'm sure we have a long way to go. Yeah.
It's like looking forward, our vision is like going to change a lot of people's life, like patients' life,
Correct.
the outcome,
Correct.
the treatment that they are going to receive.
True.
We can talk about how we can impact in case of a PPH, post-pregnancy, bleeding that is happening. So, in that way, what do you think, Jeremy? How we can help district hospitals or rural public too?
Yeah, I mean, specifically to PPH, obviously, you know, pregnancies are going to continue to happen,
Yeah.
deliveries are continuing to happen, and unfortunately, some of them will have a complication. That's something unavoidable. And deliveries happen in every nook and corner of our country. And district hospital is well equipped today to do a normal delivery. So I think Elitemed can certainly help in upskilling the local talent. So let's say we find the local set of doctors who are doing the deliveries, and they don't have either the training or confidence to manage a postpartum bleed. So Elitemed can actually help them there to look at the infrastructure, train them, provide them a cohort of doctors in the catchment area who can go in an emergency situation and help. And I think today they don't have access to that.
Yeah.
So if, for example, let's say we choose the district, my own district, Kodagu in Karnataka, there are obviously many deliveries happening every day, and unfortunately some will bleed, so they'll have to either ship them to Mysore or Mangalore, or some of them are coming to Bangalore. And I'm sure we may not have data on this, but sadly to say, we may have lost a few young patients there. So I think if we can create a cohort of doctors who are trained to go and provide a service, so even if you have, for example, you have a high-risk pregnancy which is going to delivery, they can have the team ready, and then they can definitely make a difference there. And I think Elitemed can take it upon themselves to see how we can fulfill this gap. Very doable, I think, because it doesn't take a lot of investment in terms of infrastructure, because these facilities are already provided. And interestingly, the government initiative also is there to back it up, making every district hospital equipped in many ways. So once the skill set is provided, either through Elitemed or training them locally, then I think that can be a huge initiative. It's almost like saying, like many years back, infant mortality rate was very high. It has come down because of many initiatives by pediatrics and the government. So postpartum hemorrhage can become a thing of the past. Why lose a mother who's given a successful delivery? And I think it'll be extremely nice to see and make it happen. So yeah, I hope Elitemed will fulfill this goal for sure. I think it will be a huge feather in the cap once we achieve this. But I believe that it is doable. We'll have to find a mechanism for it, do a lot of work, but doable. Yeah.
I think we need to have more talks, more discussion on what are we going to bring out for the general public and also to medical students.
Yeah.
I can understand it's exhausting to do a talk on an.
Yeah. True. Yeah.
Because there is a lot to talk about in it.
Correct. Yeah.
A lot of opportunities out there.
True. Yeah. I mean, it's a great beginning, right? I mean, it's a great beginning and a long journey. Like I always say, more than the destination, the journey is to be enjoyed. So I think there's so much to be done. That's the exciting part. So much to be done.
So much to be done.
And we'll try and do our best to make that happen. Yeah. Thank you. Thank you for that.